You guys seem to really enjoy the last mock MMI video, so here's a part 2. So I've got a bunch of questions for you: role play, communication, ethics, everything. It's going to be 7 questions, and so I'm going to ask you guys a question in this white top, and then I'm going to give you a couple seconds to think of your answer, think of what you would say, pause the video, and then in the black top I'm going to give you a model answer, and then I'm going to come back and give you some tips on how you can answer it, what you should mention, what you shouldn't mention, and stuff like that. I've got 7 questions, starting off with question number 1. So you are a junior doctor who's just been told to break some bad news to a patient, and you need to inform them that they have a life-limiting disease and they only have a few months to live. Once they've been informed of this, they now start to cry. How would you respond? Okay, so in this situation, I would make sure to make an effort to have open body language and use silences. I know it's really important to just allow the patient to take in what they've just heard, so I wouldn't try and like fill in the silence, saying more things. I'd give them time to digest what I've just told them. I'd show empathy and I would recognize and acknowledge their emotions. If they looked just really distraught, which I'm sure they are, I would just express that I can understand this is a shock for you. I understand this might be a lot to take in. Also, as part of the spikes method to break bad news, earlier on I would have made sure that the room would have been set up appropriately. So I would have the chairs kind of slightly facing but not directly head on. I make sure to just engage in eye contact, make sure that they know that I am listening to them, I am hearing them. I would also make sure to check if they have any questions. So once I have broken the bad news, acknowledge their emotions, just allowed them to take it on board using silences, I would ask them if they have any questions about anything in terms of investigations or in terms of like moving forward, what's the next steps. I would answer all those questions, and I would also make sure to be as honest as possible. If I don't know the answer to something, I would let them know that I'm not quite sure, but I'll speak to one of my seniors. Also, I would make sure that I would reassure them that, I'll speak to, as a team, as a healthcare team, like we are going to do our best to make sure that you are okay and you are well looked after, and we'll give you the best quality care that we can. Even though you do most likely have a few months left, we will just make sure that you are as comfortable as possible and as looked after as best we can. Also, as part of spikes, I think the last S is strategy and summary. So I'd make sure to recap kind of what we've gone over, and then I would make sure to make a plan for when we are next going to meet up with the patient and what's going to happen next. So if you've done your research on breaking bad news, you might have come across spikes, which is pretty much a guideline or just like an outline of how you should break bad news. I'll quickly run over what spike stands for, but if you have covered spikes already, you can skip to question 2. S stands for setting up. So you want to kind of set up the room, choose a private room, choose a room where you're not going to be interrupted, and make sure that the chairs are kind of facing each other but not like head on, like kind of at an angle. Make sure you've got some tissues in that room, and just make sure the room is ready for you to break the bad news pretty much. P stands for patient perception. So what does the patient already know about this illness? Do they have an idea of why they got certain scans, why they got certain investigations and stuff like that? I stands for patient invitation. So kind of ask the patient like, I've got some bad news, would you like me to break it to you today? Or I've got some things to explain to you, do you want me to do it now? Check with the patient if they are ready to have the bad news broken there and then. And then it's K, so K stands for knowledge. What does the patient already know about their disease, their illness? What do they already know, and what more do they want to know? Make sure that you're answering all of their questions. And then E stands for emotion, so recognizing their emotions. If they are sad, acknowledge that, I know this is quite overwhelming for you. I understand if this is like quite a lot to take in. Recognize their emotions and have empathy as well. I think E stands for emotion and empathy. And use silences. You don't want to like fill up all the silence. Like, it's okay for it to be a little bit awkward, or for it to be a bit quiet. Like, just let them take in what you've said, because it's obviously quite a lot. And then the final S is strategy and summary. So make a plan for when you're next going to see the patient. We're going to meet up next week and have an appointment about what the next steps are, or we're going to start treatment soon. And then you also want to summarize, like, what have you touched on today, what have you covered? Okay, so question 2. Okay, a 14-year-old patient requests birth control pills from you and asks you not to tell her parents. What would you do? So in this situation, because the patient is under the age of 16 and they're requesting contraception, I would have to assess whether they were Gilick competent or not. So Gilick competency, I think, comes into play when there's a patient under the age of 16 and you have to kind of assess whether or not they do have capacity to make their own decisions on getting a form of treatment. So that would come into play in this situation. So in this situation, I would try and have a chat with the patient, with the 14-year-old, and try and make her as comfortable as possible, because I can imagine at 14 it's quite daunting to come to the doctors on your own and make such a big decision like this to ask for contraception. So I would try and have a conversation with her, try and figure out what is the nature of this relationship, because if it is consensual, that's perfectly fine. However, if there is the risk of harm or abuse, or maybe even her being coerced into asking the doctors for contraception, if she's being forced to do that, then in any case where there's the risk of harm or abuse, you do have to breach confidentiality just for the sake of the safety of the patient. So in this case, I would try and understand, is this consensual, is it not, just to make sure that there's no harm being done to the patient. Once I've done that, I would check that the patient understands what contraception is, what its purpose is. Does she understand fully why she needs to take it? Also, does she understand pregnancy and the implications of that? Does she understand what that is and everything? I think it's really important to make sure that the patient has a really good understanding of what she's getting herself into. And I think checking her understanding and checking that she understands just what contraception is, what pregnancy is, that would maybe check whether or not she is Gilick competent. I would also make sure to check that I would try and encourage the patient to tell an adult. I know she said that she doesn't want to tell her parents, which is understandable because it's quite a scary thing to tell your parents at 14, but I would try and encourage her to tell an adult that she trusts, or an adult, maybe like an older sister, older brother, older friend. I would try and encourage her to tell at least one adult, just so that they can kind of check in and make sure she's okay if anything goes wrong with the contraception, or to just remind her to take it and stuff like that. This is a classic case of Gilick competency. So this is pretty much when a patient under the age of 16 might ask for a form of treatment or healthcare, or in this case contraception, and you kind of have to assess whether or not they have capacity. So this is, can they fully understand what is going on and make their own judgment on whether or not this treatment is right for them. So guys, editing Christina here. Whilst filming, I didn't give the best explanation of Gilick competency, but it is quite a difficult topic to wrap your head around. But this picture right here explains it really, really well. It's pretty much the 4 points at the bottom. You want to check that the patient understands why the treatment is needed. So in this case, it's obviously to prevent pregnancy. Also, the benefits and risks, can they kind of weigh up the pros and cons of it? And as well, what are the consequences if they don't take the treatment? So in this case, it's if the 14-year-old doesn't take contraception, she might get pregnant. And then the last one, make sure that they're free of coercion or pressure. I think in my answer, I did a really good job of emphasizing that point and explaining that bit, but I probably lacked the first 3 points. So you guys want to really touch on, can the patient weigh up the pros and cons, and do they fully understand what the treatment is needed for? You kind of want to touch on the fact that if they are being coerced, then you would have to breach confidentiality, because anytime that someone's at risk of harm or abuse or anything bad, you will have to breach confidentiality. Mentioning this just shows that you're aware of the fact that doctors have to ask about certain things that are outside of clinical and medical things. They do ask about kind of the social side of the patient. Okay, so question 3. What was the last challenge you faced and how did you overcome this? So during a long time in school, I was part of school council, and a large part of my role was to make sure that everyone in the team kind of was up to date on new information and any updates going on between our team, the school council, and the head teachers, or our team and students and stuff. I had to make sure everyone was kind of up to date. So my job was making sure that I was emailing everyone, keeping them up to date for all the meetings and discussions that we needed to have. So at one point, I remember that the IT systems were down in school. There was no Wi-Fi, so my job of communicating with people through email was kind of, that was off the cards. I couldn't do that. And we had an urgent meeting that we had to have, I think, within the next few hours. So I was kind of worrying, how am I going to get all this information out to other people? So I kind of just took the initiative to brainstorm what are the ways that I can communicate with everyone in the school, on the school council, within the next few hours before this meeting. I did consider waiting until the meeting to tell everyone the new information, but we only have a limited amount of time in these meetings, and I thought that probably wasn't the best idea. So I decided that it's probably best to go with the decision of just texting everyone. I know it's, I guess, less professional than email, but you know, we are all students, and I guess the important job of just getting the information to everyone is more important than, I guess, the method of communication. So that challenge of just having to overcome not having the Wi-Fi and the IT systems to communicate with other people, I found that brainstorming ideas to overcome that, and then going with the best option and not waiting too late until we were at the meeting was probably the best option to go with. I find that with any problem or challenge which you're quite time constricted in, it's always best to maybe try and stay level-headed and not like overthink too much. Try not to panic too much, even if you are restricted with time. Just try and brainstorm what are the possible solutions, which one is the best one to go with, and then just go with that. Worst case scenario, I could have spoken to a senior colleague, I could have spoken to one of my teachers or the deputy head teacher to try and ask them for their advice. I didn't need to do that in that situation, but that is something that I could have done as well. So with this one, you really want to have a think about something that you can say beforehand. I really think it should be part of your interview practice. Just having a think about, you know, what are all your strengths, what are all your weaknesses, when's the time that you overcome a challenge, what's the biggest obstacle you face. Questions like that they might ask you guys, so it's worth having a think about before your interview. It doesn't have to be anything big either. It can literally just be like you helped a woman at the supermarket, or you had a challenge where you're really struggling with a certain piece of revision. It can be small things like that, helping out a friend, overcoming like a personal issue, maybe like family issues. Yeah, so it can literally be anything. Don't worry too much about the actual example, just at least have one before your interviews. You do kind of want to touch on and highlight like what qualities did you use to overcome the obstacles. So I talked about it was quite time constricted, you know, we were quite tight for time, but I did try and stay level-headed. I brainstormed ideas, and that's how I overcame it. For you, it might be maybe like you reached out to someone, you realized you don't have all the answers, so you're going to kind of reach out for help. Okay, question 4. Use your communication skills to explain what DNA is to a 5-year-old. Hi there, what's your name? Okay, hi Hazel. So I've been asked to explain DNA to you today. Have you heard of DNA before? Okay, so DNA, it's a complicated thing, but I'll try and explain it to you the best I can. So all humans, all animals, even all plants, we all have DNA. So the thing that DNA is essentially this tiny thing. It's kind of like a string in a way. So it's this really long string, but it's super tiny, and this super tiny string is inside each one of our cells. So do you know what cells are? No, yeah, I didn't think so. So if you imagine, like, I guess we're people, plants are plants. The things that make up us as people are tiny cells. So we have like millions and billions of tiny cells. And if you imagine, it's quite difficult to get your head around, but that tiny string of DNA is in each side, every single one of our cells. And as you can imagine, we have lots of DNA, so do plants, so do animals, but DNA has a really important role and job. So does that make sense so far? Okay, just to recap, we have lots of cells, and DNA is like a tiny string inside each one of our cells. Okay, so the role of DNA is to, it's a bit tricky to explain. The role of DNA is to kind of give ourselves the instructions of how to make our bodies and how to make different parts of our bodies and how to repair it. So I guess I can explain it in this way. So if you had like a Lego house and it was made of lots of different Legos, the cells would be the individual Lego, and then our bodies would be the Lego house, if that makes sense. So the way that DNA works is, imagine you had the instructions for the Lego house, like the manual or the instructions, and it was super tiny. You've made it super tiny so you couldn't read the instructions, but imagine that set of instructions was on every single little Lego. That is kind of what DNA is. And yeah, as I mentioned before, the job of DNA is to just give our bodies the instructions on how to make our arms, how to make our legs, how to make our hair, our nails, everything like that. So I hope that makes sense. It is quite a complicated thing, but yeah, that is what DNA is. So with this one, you do want to start off with consent and informing the person what you're going to talk about. That's kind of why I touched on in my answer, like, I'm going to explain what DNA is to you today. You do want to kind of mention like what's going to be happening and stuff, just because it shows that you're aware. As a doctor, you won't just go up to patients and examine them. You will kind of introduce yourself and explain, I'm going to examine your chest today, or I'm going to examine your abdomen. So if you can kind of drop that into this role play way, that would be quite cool too. You know, I'm going to explain what DNA is today. Is that okay? With these communication questions where it's like you explaining a really complicated topic, you do want to constantly check if it makes sense with them. I probably didn't do as much of that as I could have in my answer, but you do want to constantly check, does that make sense? Are you following still? You know, does that make sense and stuff? Especially because they're 5. Like, it's also really good to use little analogies. So I kind of described DNA as a string, and I know that you could say it's like a double string, like a ladder. I could have said a ladder, really, that would have been good. But yeah, you just kind of want to make it really easy for them to understand, so using like simple objects that they'll know. Yeah, that's why I kind of used the Lego house as well. But yeah, I should have said a ladder actually, that would have been really good. That's probably what they're looking for in your answer. So if you get this question, maybe describe DNA as a ladder, that would be really good. You also want to avoid like big words and like overcomplicated jargon that 5-year-olds won't know about. So it's much better to like oversimplify and make it too simple than kind of mention some big words just to get it accurate. Okay, question 5. Why do you want to study medicine and not study to be a paramedic? Yes, so I guess the role of doctors and paramedics is fairly similar. You're both going to be treating patients, and you're both kind of just trying to keep, you're both just treating patients. I didn't get to spend much time with paramedics on my work experience. However, I did spend quite a bit of time shadowing doctors, and I know that their role is very patient focused. You do spend most of your day either treating patients or organising scans and investigations to help the patients, or you spend time with the healthcare team, you know, nurses, pharmacists and stuff like that. As a paramedic, from what I know that their role kind of includes you know, if someone rings 999, that, you know, a paramedic team will go in an ambulance to pick up the patient, assess them, try and keep them alive, treat them, and then transport them back to the hospital whilst trying to keep them alive. That does, you know, that is similar to medicine in some ways. However, I know that with medicine, as a doctor, you can specialize in so many areas, from GP to pediatrics to dermatology and emergency medicine. It does seem like with a paramedic career, it's mostly emergency medicine that you'll be focused on. And I just like the fact that with medicine, I have lots of different options. Also, I don't quite know what the progression looks like as a paramedic. So I know that as a junior doctor, you can go from a junior doctor to a registrar to a consultant, and, you know, research, you can own your own practice, you can start your own clinic. There's just so many options. With a paramedic, I'm not quite sure if the level of progression is the same. I feel as though my traits, qualities, and my academic performance is just best suited to becoming a doctor. So I feel like that's probably the best option for me. So you might have seen this version of a question come up quite a lot in terms of like being a nurse. I've seen quite a lot on like mock MMI question pages, or like MMI question banks, like why do you want to do medicine and not nursing and stuff like that. So I thought it'd be interesting to actually put paramedic instead, just because you don't see that quite often. So yeah, with this answer, paramedic's a bit of a difficult one because not many people know that much about it. So the main differences you want to focus on in terms of being a doctor and then being a paramedic. As a doctor, you are a lot more clinical focused, so you will be focusing on treatments, drugs, prescribing, investigations, scans, blood tests, whereas as a paramedic, there's a lot less of that. So your job is mainly focused on caring for patients in emergency situations. They do respond to emergency calls and transport patients to medical facilities, so hospitals. You could also touch on the fact that being a paramedic is a lot more medical emergency and trauma focused. So obviously, if you think about people who ring the ambulance, it's not like they've got a tummy ache or a runny nose. It's like really serious injuries and stuff like that. Whereas as a doctor, you can specialize, as I said, like so many different things. So I think that's probably a reason worth mentioning. Okay, question 6. How do you think you'll be able to cope with the stresses of medical school? So I've read a bit about, what life is like as a medical student and what the workload is like at medical school. And I do know that it's incredibly stressful and it can be a lot of work. It's miles and miles ahead of the workload of A-levels. So I am well aware that I'll have to have a work-life balance to make sure that I don't have, I don't feel overwhelmed and I don't let the stress get too much. So what I currently do, because A-levels can be quite stressful at times as well, I try to play netball regularly. It's something simple, I just play once or twice a week, but just having that break outside of work really does help me to kind of de-stress and take my mind off of work for a bit. I also spend time with friends. I think everyone does that, but that really does help me as well. It's probably the most helpful thing, to just take a break from work and to have a laugh with friends, take my mind off of things. I also do yoga sometimes, so another kind of form of activity that really helps me. I find it quite relaxing. So both netball and yoga I do plan to keep up with at university when I'm at medical school, because I know that if it's helping me now, it probably will help me when I'm studying a much more difficult course, a much more time intensive course. So yeah, in terms of managing stress, I think maintaining a work-life balance, making sure that I'm meeting deadlines and getting my work done, but also making time. It's super important to make time for breaks and to relax as well, just to make sure you don't burn out, because I have burnt out before while studying for my A-level exams in year 12, and I know how important it is to not pull all-nighters, not study 24/7, to actually have breaks so that you don't burn out. So this question is essentially checking whether or not you're aware of how important it is to have a work-life balance. So you really want to touch on how important it is to either not burn out or take a break from studying, just to make sure that you're working at your optimum. You can't be productive unless you are taking breaks. It is super important. Coming into medical school is like obviously a big achievement, but when you're actually here, it's a lot of work and it's maybe not as glamorous as you think it is. So dealing with the stresses of medical school is super important. I think this is a really great question for them to ask you guys. If you want to talk about the things that you do to have a balance with your A-levels, or maybe if you're a postgrad, like your degree, you can touch on that as well. So whether it's sports, cooking, baking, literally anything, like hanging out with friends, as I mentioned in my answer, you want to kind of highlight the fact that you do have a work-life balance now, and you want to talk about how you'll maintain that at medical school. So last question number 7. Why do you want to come to this medical school? So I'd love to come to Newcastle Medical School because I really like the style of teaching. I read a bit about case-based learning and I've watched some YouTube videos about it, and I know that it's kind of a mix of lectures and small group teaching. It's not quite the same as PBL because you do have quite a lot of lectures, but it's not quite integrated in the sense that it's not entirely lectures and just lecturers kind of telling you all the information. There is a bit of independent study, so I like the fact that it's a bit of a mix. I also like the fact that there is early clinical contact, so unlike some other courses, you will be seeing patients within the first year. Obviously it's quite different now, I'm guessing, because of like the pandemic and social distancing and stuff like that, but from what I've read online, you will be seeing patients within the first year. You will see them fairly early on, so I quite like that because I'm quite a practical person. I'd love to be able to learn about different diseases in my lectures and seminars and then be able to apply it to real patients on the wards and stuff like that. I also really like the fact that Newcastle is a great city. I've been a couple of times before, like visiting on open days, and I really like the town centre. I love that it's a big city as well. I'm from a big city because I was born in London, so I like the fact that Newcastle's quite big as well. It's not like a small town. I also really like the fact that it's quite a big course, so I think there's just over 300 people in each year group. Again, coming from London and a big city, I like the fact that there's a lot of people. It's not like too small or anything. So yeah, I feel like the style of course, the city, the cohort size, it's all just well suited to me and my personality. Definitely it's worth having a read up on each individual medical school interview that you go to. What are some of the things that you want to mention in this question? So what are some of the things that you really like about my medical school? So is it the teaching style? You really like PBL? You really love traditional? Or maybe it's the city? That's a great thing to talk about as well. So yeah, literally anything you can talk about your personality as well, like I did in my answer. I genuinely think the style of course at Newcastle is best suited to my personality because I do like independent study, but I also want some direction. So I like the fact that we have lectures as well. And early clinical contact, that's a good one to mention as well. So for 6 more questions, if you want some more mock MMI practice, I've made a whole entire other mock MMI video. And if you want some other tips on what to wear to your MMIs or just some MMI general tips and stuff like that, I've got a whole entire MMI playlist. I'll put that here. So yeah, I hope you enjoyed this video. Make sure to like and subscribe, and I'll see you in the next one. Good luck for your interviews. Bye.